Next week, children aged between 5 and 11 become eligible for vaccination. If you have a story you're willing to share about getting your child vaccinated, drop us a line at 7.30@abc.net.au. Access to rapid antigen tests has come to be seen as a key way of both identifying COVID cases in an otherwise overwhelmed testing system and of minimising disruption to businesses. But tests have been in short supply and have been much more expensive. The opposition stepped up its calls today to make the tests universally free, as did other groups like the AMA, the Public Health Association and pharmacists.
The simplest, most cost-efficient way is to make free tests available.
National Cabinet this afternoon decided against making rapid tests universally free, instead endorsing a plan that will allow people who are symptomatic or are close contacts to access them for free at testing hubs, as well as allowing concession card holders to access some through pharmacies, at the same time as removing a range of testing obligations designed to reduce queues for PCR tests. Sharon Lewin from the Doherty Institute said last night that based on current rates of infection, we're looking at about 200,000 infections per day by the end of the month, which is a big number. But I just wondered, what statistical evidence have you got about the extent to which the measures you've taken today reduce pressures on the various testing hubs?
By removing unnecessary sources of demand, i.e. truck drivers having to have the rolling tests, having to have PCR tests to confirm a RAT test, that obviously will reduce the demand. Ultimately, that's where we'd like to be after a few weeks, where people would go to those testing centres, just be handed their box, and then they will return to their own home where they do their tests. And we're working on a system through our GPs and other processes for people to report whether they've got a positive test. The reason we want people to report is not to count numbers. It's not about counting case numbers, it's about connecting people to care.
But none of this solves the problem of people who wish to buy or get access to tests for reasons such as testing themselves before visiting an elderly relative or even just meeting family and friends. What commitment can you give that people will be able to get access in a commercial environment, if not free, because most of the purchases you're talking about will be going through the state systems?
I mean, supply will continue to be constrained for pharmacies and supermarkets over the next couple of weeks. That's what they've told us. But then they are anticipating that their further supplies will be coming through, and that will increase their availability right across those areas. But as you rightly note, they are tests being provided not for essential purposes as defined by the medical experts, but for convenience purposes, casual purposes and other peace of mind purposes that they may be seeking for exactly the quite genuine reasons you set out. But those supplies will be constrained for the next few weeks, and so people then should exercise caution when they're coming in contact with vulnerable people for exactly that reason.
One participant in National Cabinet meetings is the ACT's Labor Chief Minister, Andrew Barr. He joined me a short time ago.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.